Well, howdy, folks, and welcome back to another episode of Follow the Leader. I'm your host, Lee Larson, and joining me from Fort Worth, Texas, is my mom and Dr. Shelagh Larson, women's health nurse practitioner. Welcome to the studio, Mom.
Hi, baby. Hi. Hi, baby dog in the background.
Oh my gosh. For those who are not watching, who are doing this audio, my dog, Professor Huckleberry, is generally sleeping on the couch behind me. Mom. So I am bringing my mom on here, not just because she's an awesome mom, thank you for birthing me, but she's a very accomplished women's healthcare professional. And I am so looking forward to talking about menopause today with you, as well as just general women's health care in Texas. And folks, in order to establish a little bit more credibility, Dr. Shelagh Larson, DMP, APRN, WHNP-BC, NCMP, FAA-MP. That's a lot of letters. It is alphabet soup behind your name. You are a board certified women's health nurse practitioner, nationally certified menopause provider, and International Society for the Study of Women's Sexual Health fellow. You're down in Fort Worth, Texas. You went to UT, got your BSN from UT Medical Branch, and got your women's health nurse practitioner in 2003 and your doctorate in 2018. But that's not all, though. You've also led seminars translated into 23 languages for refugee services to educate thousands of refugee women that have come to the United States and are in Fort Worth, Texas, to how they navigate women's health care. I am just blown away by that aspect, but you also do all these conferences around the country talking about menopause, talking about processes, and I mean, you're a very, very accomplished woman. So I'm really excited. But before we get into the advocacy and the women's healthcare part, guys, we have a common enemy, Ted Cruz. We have to talk about this. We have to talk about this. You know, Mom's been doing this all my life, all this advocacy, running down to the Texas Capitol, doing conferences around the country, and not, I almost said it sarcastically, but I couldn't even bring myself to joke about it. I almost called him your personal close best friend, Ted Cruz, who you have met. Your best friend.
My buddy.
You're,
My
yeah,
bud.
yeah,
We're
yeah.
tight.
You're tight. Top 8 on MySpace. Like he's in your close friends. Uh, no, opposite. My mom has
No.
gone for women's healthcare advocacy related issues to Ted Cruz, and he has said no countless times over the years. And guess what, folks? In the last year, their marketing person on the Ted Cruz, his website, used a photo of him and my mom and another women's health colleague all shaking hands, doing the lobbying thing on his website as if he is an ally. and
Yeah.
and
Like he's
uh,
ever
and,
addressed anything.
and
No.
I was so you like the shock of it. I mean, we laugh because it's so insulting. Like this man has done so little for women's healthcare in Texas. Here's you, this advocate with another advocate for women's healthcare. They snap a photo and then they use it on his campaign website. It's a disingenuous, but it's I mean it's you have to laugh because it's so insulting. And we made a big stink about it, or at least I did, online about a year ago, and it was removed. Like enough people tagged
Yes.
his team to be like,
Yeah.
"Hey," and a lot of women kind of
Whoops.
rallied around that. And but again, we're laughing because it's just a mad. Like I'm like, you son of a, and but
It is an outward sign of how out of touch they
yeah,
are
yeah,
with their voters.
right. It's like it's funny. It's like hysteria. It's like an angry hysterical. Like you're out of touch with the voters. You are using and exploiting my mom. Like, I'm like, Ted Cruz, I left Texas, but I'll come back. Like, you're about, like, what you doing going after my mom? Like, um,
Don't
and
make me come back to Texas.
now it's personal. Like, then, but, uh, but anyway, um, that has been done. But it still comes up, and for my listeners, my gosh, what a story that we went through with that Ted Cruz thing. And like I said to the followers, y'all got it handled. The website took it down, and she's not on there anymore, which is correct because you have not supported my mother or women's health care and what she has lobbied for over the years. Talk to me. I mean, uh, wow, Fort Worth, Texas, Dallas Fort Worth, the airport is that is one of the largest known areas of where we're seeing a lot of immigration, a lot of refugees. I think Atlanta airport is also another port of entry. I learned all this when I was down in at the border of Mexico that it's our airports, not our bit borders with other that most folks are coming through, and you see a lot of that on the women's healthcare side. So talk to me about how you started these seminars and again translated into 23 languages. What does that? What do those some of those seminars look like?
Well, first of all, thank you, baby, for having me on. The DFW, as well as Atlanta Airport, not only is it a hub for so many immigrants, it is the rest of the country has this great big picture of how all these immigrants are coming through the border and swimming across the Rio Grande, particularly in Texas, which, by the way, three-quarters of it is dried up and is land, so I don't know where they're swimming. But for the most part, it is also a huge sex trafficking gate. That's where so many, if not a majority, if not all of the women that have been sex trafficked outside the country, that is their port of entry as well. Some of those may be the one and the same, the immigrants and the sex trafficking, but we hear that all the time from people that aren't in Texas. Oh my gosh, you've got all these immigrants pouring in. And what are you going to do about the border? And I'm like, forget the border. They need to go to DFW Airport because many people come in on a holiday visa and don't leave. But regardless of how they get there, how they get to either Texas or the United States, I believe in the humanitarian efforts. We got to take care of the people. I don't care where you're from, what color you are. It makes no difference. I am one person taking care of another one. So we worked with the Refugee Service of Texas, which had the Fort Worth chapter, and women or families that were sponsored to come into the United States in literally countries across the country, across the globe, Africa, Middle East, South America, the Philippines, you name it. I have done training on those women because for many of the women, particularly the low income women that have come in, their healthcare system over in their country either does not exist or it's very limited. They mostly are, they do only treat women and children and families only when they're sick. They only go to the doctor when they're sick. That's hopefully not how we do it in the United States. Our goal is to prevent illnesses, and therefore you don't have as many hospital or emergency room visits. So we brought in with the Refugee Service of Texas, when they would bring women in, families in, I would have at least a 2-hour seminar with those women. And I have anywhere from 3 to 7 translators at one time in those classes. They're very informal. They come in, we sit around, and I show them all about the differences. I tell them about what is a well visit and why is that well visit important, not only for that mom, but also for her children. Why do we bring children in for vaccines, for hearing tests, for eye tests? We talk about what is the expectation on a well visit. for many, that is something they've never heard of, a new concept. I also talk to them about pharmacy. They don't understand. They think that they have to come to me every time they need a prescription, for example, a birth control pill. They think they have to come back to me to get the next month. Or that they think on some of these other clinics across the globe that we're going to hand them the bottle right there. It doesn't really work though. We have CVS, Walmart, Walgreens. We have all these pharmacies that we send to. So that is a new concept for them. I had the conversation of when to call your clinic visit. When do you go to the clinic versus when do you go to the emergency room? Don't go to the emergency room because you need a refill of your prenatal vitamins. Those kind of things. Really interesting because these women, they had no concept. The last part of the talk, I actually brought out the speculum and passed it around, let them touch it, let them feel it, open it, and explain to them when I'm doing a PAP, this is what I'm doing, this is what we're looking for. I also brought all the different birth control options, discussed each one of those, what they do, and how our job is not to prevent total pregnancies, but just until you're ready to get pregnant again. Buy you a little time, and how each one works, and those don't cause sterility permanent. Contrary to some of the cultures out there, they will tell women that that's actually what causes sterility is being on birth control. We have a long talk about that. Allow them to ask questions. Interestingly enough, some of the older women that are in the group, because they have been the matriarch of the group, and they will tell women, you can't, you don't do birth control. I actually kind of go against some of what they've been taught and their cultural norms. So it is very interesting because some of these young girls are kind of looking at me and them and like, who do I believe?
That's hard.
I give them information. The goal is now they're having a conversation. Now they have a conversation. Even if they didn't buy everything I said, now they can go back and have they have knowledge. And that is my whole goal of those was now knowledge is power. We did these quarterly up until the COVID. And COVID came, everybody was afraid, and so they recorded me. And that's where it went to so many different languages. They recorded me in English, and then they can go to the Nepali, the Afghanistan, the Dari, the Kinyarwanda, the Swahili, the Spanish, and they could break that up and have the translator do it while the video was on. So that is how the numbers got so exponentially high, is quite honestly, I don't know how many times that was translated because they now can do more one-on-one. And since they stopped it during COVID, stopped having me come in for COVID reasons, unfortunately, they lost their grant. And so after COVID, they had to fold. And so we haven't been able to pick that up, unfortunately. Another part of that conversation was we did talk a little bit about menopause because many of those women had no idea what that was. And so we did touch a little bit on that. So the beautiful thing about that whole setup, Lee, is it set them up to going now to a provider and they're not afraid. And the premise on that was, again, knowledge is power. But also, I cannot tell you how many times I said over and over in those 2.5 hours, I am here to support you. What you tell me, I can't tell your husband, I can't tell eyes. I am here to support you. And I think for many of those women, it was the first time they have been seen and heard.
Well, particularly if they're refugee or if like a lower income, they haven't had health care like that, access, like whatever's going on. And there's also so many different cultures too that the husband accompanies the wife and speaks for her in medical situations. And so some of this is probably a little overwhelming or new or scary, and what you're doing is trying to empower them with information. And like you said, there's just a lot of nuance and things that folks don't consider with when with culture and healthcare that have been really eye opening, at least in my travels, and I'm sure for you as well. Um, can you can you talk about? I want to stay on this for a little bit longer. Forgot to ask earlier. Can you talk about this Ted Cruz? Like, what did that feel like to like be denied by some like by advocating for women for over a decade, and then to see like him use that like that? It just feels so dirty.
I have gone to DC 13 times to see him. Not just him. Our both of our senators, my House of Representative. Sometimes I will go see other House of Representatives, and it's as much as it is women's health. It's also just flat out health care, things that you know is non-gender. I mean, just flat basic health care that we're fighting for. I work for a county hospital and a clinic. So I not only see the immigrant, the refugees, I also see the low or the underserved, the underinsured, and it's kind of like we're the safety net for everybody else. But during the latest cuts in insurance, we also get, in my clinic, of course, I see women in the women's clinic. We have women that have good jobs, but they've dropped their insurance. And so they have to come to a county hospital. So I'm actually seeing the women that are on the Medicare, Medicaid, all of the state funded Medicaid that's out there. And so I am speaking to those patients that they are making decisions on really at the Medicare, Medicaid level. And so I know what is going on in the field. I know I'm kind of that cavalry that's having to go out, and I'm coming back saying, hey, this is what's working, this is what's not, year after year after year. And all he wants to do is take a picture. Hey, just smile for the camera, next. And so it's really frustrating because when you really come in there with some solid concerns and all he wants to do is take a picture, and he just looks around the room and find out, who's the biggest donor, and that's the one I'll talk to. It is frustrating because you just sit there and shake your head, and as more and more research comes out about women's health, STDs, that are both men and women, you're going to see how many diabetes, all of this stuff, and you're like, we have some answers for you if you would just listen. And that's what's really frustrating for a healthcare provider that's working out in the grind out there and not having your legislation, your policy makers hear what's going on out in the real world.
Yeah, and it's just frustrating overall.
But to see him turn around and use that picture, you're like, really? Because you're looking doe-like in my eyes, like you're proposing, but you aren't listening to a thing I'm saying. So, yeah, we had to laugh really, really hard on that one.
Well, it's just it's so typical, and I don't even know if his, I don't know if the web person, the photographer, even like knew like that. I don't even think it was intentional. I think they just saw that picture and they were like, "This is great. We're gonna use it." And it was like, you kidding?
Well, they didn't have my name on it or anything. As much as it's Ted Cruz, and it's so funny because I have actually, the last two times he's run, because of his actions of when I personally have been in his presence, I have actually campaigned against him. I want somebody there that sees me and hears me, and therefore hearing and seeing what is going on with his constituents. And that's the part that's really frustrating. The irony that he would use my picture.
Well, and folks, this isn't just like on the website page. It's like the main photo when you it was like issues, I think was the page name. Like,
Services,
you know,
yeah,
yeah, yeah,
services.
yeah, or something. It was just like, on the tabs where it's like about, issues, services, contact. Like you click on services and it was like, that's my mom. Like the front and center, big picture. So, like, what services have you ever said? God, but whatever. Like, okay. Well, let's talk. You mentioned earlier that a lot of the low-income refugee women that you are seeing, um, are not familiar with menopause. But turns out a lot of American women aren't either. It's just
Mm.
something we don't talk about. In fact, the world really doesn't. Um, and it's something that every woman will like, or every, if
Every
as long as
single
you have
woman
a
will go through.
uterus, I guess, we'll go through, but we just don't know anything about it. So let's talk. What is you did labor and delivery for a while, then you moved over to menopause. What what are things about menopause that what is it? What is menopause? Let's start there.
What menopause, literally defined as menopause, it's the pause administration. It's when you have become your 3 point, if you will, your 3.0 self, the little girl before you have periods. I call that your 1.0 self. Back in the days, I don't know, your Barbies, dolls, the time when boys had cooties, we did not make the reproductive hormones. And then once your period starts, you have the reproductive hormones, primarily estradiol and progesterone. Women also make testosterone. It's a misnomer that men have cornered the market on that. Yeah, they make more, but women actually make testosterone too. Those hormones go together like peanut butter and jelly and bread. And then starting at about 35, those hormones decline. They decline because we've been throwing eggs out every month to have our periods, ovulation, and we only have a finite number of eggs. And so when we decline, when those eggs get thrown out or when they've been used up, then our periods stop and we are no longer reproductive. We actually say after the age of 35, pregnancy, you're at high risk. Pregnancy after the age of 35, we call it advanced maternal age. It's hard to believe a 35-year-old is advanced. But if you don't like that name, we also call it geriatric pregnancy. That I don't use because I have an image of Sarah in the Bible that's
Uh,
99 and pregnant.
right.
I
Yeah.
don't like to use that word. But that's because we don't make these stabilizing hormones anymore because we're running out of eggs. And so you're at higher risk for miscarriages, high blood pressure, and all the safe diabetes, the baby having genetic disorders. But what the average age of menopause? Menopause is defined as 1 full year without a period. Average age is about 51. Average range is 40 to 55. And so, at any point in there, that is when we have run out of eggs. The problem is that as we transform from that reproductive woman to the non-reproductive woman to that 3.0 self, our bodies go through physical changes. Our brain goes through physical changes. We're going to have our bones. You're going to see a lot of things happen as the body is changing into that. And many times, women are given all kinds of medication. By the time they get into the menopause clinic, they're on something for depression, something for anxiety, something for body aches and pains, something so that they don't cough, laugh, sneeze, and pee on themselves. And not to mention they have no libido. And it's crazy because this is not anything new that we've just started. Every woman goes through it, but they have been, as a culture, we actually came out with hormones in 1942 for Premarin, which ironically enough, I'm sure was probably developed by man. The reason I say that is because somebody looked at a pregnant horse urinating and said, "Ooh, I wonder if we dried up that urine and made it into a pill and gave it to women, we'd quit having hot flashes." And well, what do you know? We do. And so that's Premarin, pregnant mare urine. And now we have been giving that for decades, for almost a century now, and works very well. Later on in the 60s, we learned to get the bioidentical, the human made one, actually from plants, and we give them those hormones to women now for the menopausal, those to help prevent not only the hot flashes, which prevent sleep, which can make you anxious, and all kinds of stuff. It can make social anxiety. We give them the hormones to help with all that. But the hormones also help prevent osteoporosis. So it does a lot of things. And this has been a big push. Before, there was people, our providers, nurse practitioners, our PAs, our physicians, we were taught on it. There was a study done in the late 1990s. It started in the late 1990s, called the Women's Health Initiative. I just mentioned Premarin. Premarin was just estrogen. Worked very well, very well. Think of Oprah. You get Premarin, you get Premarin. Everybody got Premarin. It helped with hot flashes. It helped with moods. It helped with sleep. Did a lot of really good things. But realize some people have a uterus still, and they started bleeding. So we had to protect the uterus with progesterone. So we add back the progesterone, this Prem Pro. That was given for decades. A pharmaceutical company acquired Premarin in the 90s. They wanted to promote it not only as a hot flash medicine, but also prevention of breast cancer, prevention of cardiovascular disease, as well as osteoporosis. So they had to do a study, largest study ever done on women, 62,000 women, 50s, 60s, and 70s, and half had a uterus, half did not. Gave them the hormones to see how they did. The women across the board who had estrogen alone had decreased rates of breast cancer, and cardiovascular disease, and no osteoporosis. It did what they thought it was going to do. The women who started it within 10 years of their last menstrual period, or less than 60 years old, great, decreased breast cancer. It helped prevent cardiovascular disease and deaths from cardiovascular, and actually prevents osteoporosis. But the group that were in the 60 and older, that had the synthetic progesterone, that same Prempro, they found that they had one more case of breast cancer per 10,000 or 1,000 compared to the control group. They pulled everybody off, threw the baby out with the bathwater. And it was kind of like, I always tell my patients, it's kind of like that telephone game where you tell a secret to your little kid when you're in kindergarten or elementary school, and they tell the secret and it goes around, and at the end they say what the secret was, or what the whisper was, and it has nothing to do with what was started. It kind of turned into that. It did not say that hormone therapy causes breast cancer. That's not what it said. It said that there was a risk for, it was actually considered statistically rare. But by the time it was said and done, it was all over the place that hormone therapy causes breast cancer. Not only were physicians now afraid to use it, it is now being taught in medical schools, and nurse practitioner schools, and PA schools, that hormone therapy causes breast cancer next. And there was not, they missed the whole thing there. It was like, that's not what it said. And so when I went to my nurse practitioner program, I got out with the intention and started straight into menopause. So that was over 20 years ago, going straight into menopause because it was so confusing. People have down babies. We know how to have babies, and we know how to deliver. We got that. But nobody talks about, as you said, the menopause. And so it's just not spoken about. Not only is it not spoken in general public or between women, but it's not spoken in the clinical room with your provider. Women will come in, they're like, why am I having these weird periods? Or why am I getting so moody? And they're going to go, oh, you're just a crazy woman. Here's a psychotic medicine. And not realizing, this is what you're supposed to do. Menopause is natural, but that has been ostracized in the education. We're not allowed to really talk about it. And now it has become really big, really big. That is because the FDA came out in November. Because after the WHI, they splashed all kinds of things on labels that hormone therapy causes breast cancer. Wasn't true. But more importantly, also put it on vaginal estrogen. And that actually keeps, as we age, whether we age or we're breastfeeding or we're on IUDs that have hormones or Nexplanons or Depo, anything that can lower your estrogen or suppress your estrogen can actually dry up the vagina, which keeps it from getting lubricated, which maintains the pH, which also helps it kind of be thick, which means it holds that bladder up in the second floor. It keeps you from urinating all the time, frequent urinations. It can encourage UTIs because the vagina is drying up. And not to mention, you have sex, it hurts. It hurts, you're not going to want to do it again. And the nerves in that area dry up because you don't have those big healthy cells that are supported by estrogen. They even slapped it on that it's going to cause breast cancer. That is not true. Vaginal estrogen only works in the vagina. It does not go into the whole body. We actually give it to our breast cancer patients. We give it to stroke patients. Yes, I give it to patients that are breastfeeding and that are on hormone therapy like Depo or Nexplanon or Mirenas. So we're now learning more and more. And so the FDA, they got called on the carpet by a bunch of the menopause thought leaders, and they had to come out, and they did in November, and said, we were wrong. Hormone therapy does not cause breast cancer. It actually prevents breast cancer if started early. It prevents osteoporosis. It actually can keep your blood vessels, cardiovascular disease at bay. So now we're having this huge, big comeback. In fact, right now, estradiol, we can actually give it in a patch. There is a national shortage of hormone therapy in the patch form, which a lot of women like it in a little patch that you change twice. There's a national shortage. And we laugh because, there's never been a national shortage of Viagra. There's never been a national shortage of Cialis. But they are like, oh, yeah, we're not going to make enough. So it is menopause. Every woman goes through it. The difference is, Lee, you are one of the ones that are helping with this whole movement, and you don't know it, is that actually now women are becoming empowered and wanting to know I want to know what's going on in my body. I'm tired of other people telling me what's going on. I want to know. And I think with this empowerment and this real big female movement of knowing who I am, I think we're getting a lot more people interested in it and actually trying to buck the system of I want to know and what can I do? So I believe that is the big deal with menopause.
Yeah.
Long answer to that.
Oh, it was a fantastic answer, and there's a lot to pull from it. You covered a lot of ground, which was fantastic. Thank you. Like you said, there's always going to be Viagra. I know, and we talk about on this channel a lot, Project 2025, and this movement, particularly to go after birth control, IVF, menopause, like this control. And also, it's very easy for men who don't value women beyond the womb to just disregard, and disregard menopause and say, yeah, whatever, that's your sunsetting. Why? And it's just such a manly thing to do, is not care about menopause. And
I mean, if you think about it, Lee, if somebody goes through menopause, let's say 38, and they live till they're 88.
Oh, yeah.
How many years did they just spend in menopause? I mean, on average, women in the United States have, I don't know what that looks like, but 2.1 children. I guess those account for miscarriages. We have 2.2 children in the United States. So we spend all that time from about the average age is about 11 to about, they say 51, fighting all of that time trying to keep us from getting pregnant. And on average, we only have about 2.2 children, or 2 children on average. And so then after that, it's one of those. So them coming out, people coming out and say, oh, it's contraception and banning birth control. We use birth control far more than just contraception.
Yeah.
Women who have polycystic ovarian syndrome who desire pregnancy. How do we jumpstart them? Well, a lot of times we jumpstart them with birth control. Women that have acne, that have heavy periods, have fibroids, therefore they can't go to work, or they can't take care of the children because they're having cramps that are so bad or bleeding that are so bad. We use those products not just for contraception. And when you have some of these corporations out there that say, oh, we don't believe in birth control and therefore we're not going to cover it on our insurance, I have a problem with that, because this may not be for birth control. This is maybe the answer that she has to enable her to get pregnant. And so it's a hard fought reality that we live in, and of misconceptions and misunderstandings of
Yeah.
what it does.
Yeah, but it's such a patriarchal bullshit thing to do, to just like not care about menopause. Just to be like, well, it doesn't have anything to do with me, and it's
Well,
not
let me
making more
ask you,
babies.
what is
Yeah,
it
go
called
ahead.
when you remove the uterus, when you have your uterus called removed? What's that called?
A hysterectomy?
Uh-huh. Which literally translates into the removal of hysteria. We still have that name. That was done in the late 1800s when they thought if you took a woman's uterus out, we'd no longer be crazy. I don't know why, because that obviously is not the case. A man gets a vasectomy and therefore can't have children, that thing he's removing is his vas deferens. It's called a vas. It's not a dickectomy. And so why is it we're get hysterectomy? Why is that name still out there? In animals, we call it a uterectomy because we're removing the uterus. But they still call it a hysterectomy, removal of hysteria.
Hmm? We're too emotional to lead, but we're clearly, but we're in a holy war right now, and Trump's out here tweeting that he's going to nuke a civilization, but we're the hysterical ones. Oh, who was it that started every war? The women, famously, right? All the matriarchy? No, not at all.
Well, quite
Uh,
honestly, if they let a bunch of menopausal women get out there, this would have been over a long time ago.
My
'Cause
God, you imagine if a bunch of menopausal women around the world were leading, you know how good our schools would be, like our healthcare, like gardens, farms, like move, like, like,
yeah.
oh man, yeah, think about it a lot. Well, and that's the thing too, is menopause is so just not, there's a lot of misconceptions, a lot of confusion. You have worked in both a very like clinical medical space. You've worked for pharmaceuticals, you've worked for birth control, but you've also worked in the natural, holistic, homeopathic space. And so you're not like you now. How does that impact your caregiving as a medical provider, having walked in both spaces?
Yes, have been, still are. I'm a speaker for pharmaceuticals, so yes, I have done that, am doing that. I have some women who don't believe in hormones, or for that matter, medical. They just want to know. They all come into my clinic and say, tell me what's going on. I don't want anything. I just want to know what's going on. The problem I'm finding is, and again, I see some of the patients that slip through the cracks. They're the underinsured. They may be the refugees. These women are not, I've got plenty of them that are college and multiple degrees, but I have some women who are not. It is very hard because culturally I'm having to go against what they have been taught in their culture for a long time, long seated cultural norms that they have. I have women that come in at, I don't know, 53 and not having periods anymore. And they are so concerned because why is my pregnancy test still negative? I mean, I'm not having periods. They don't even know that this is such a thing that we actually stop having periods at a while, at some point, that at some point you are no longer reproductive. And that's a hard conversation when these women realize that they no longer can have children. In some cultures, if a woman is no longer able to have children, the men are allowed and it is okay for them to marry a younger woman to carry on his lineage. And the woman that is now the older one, she has to take care of this younger woman's children. So it is very difficult to have that conversation. It is, but you also have to meet them where they are. You come in with all this high tech, high education, you know, pharmaceutical mumbo jumbo. They're just thinking you're pulling one over on them. So it's really a situation where you got to look them in the eye. You got to sit down at their level. There is no standing up and talking. You sit down and just have just a conversation and just and let them know this is what's going, this is what is happening. And it's not that you have gone crazy. It is not that, you know, you are, a lot of them will come to me, the menopause, and think I'm crazy. I feel like I'm crazy. I've lost my job. My husband's left me because I no longer find him sexually attractive, or I no longer want sex, or I can't get out of bed because I'm so depressed or anxious. A lot of things happen. Jobs are lost, marriages are lost during this time, and most of it is because of misunderstanding. And so it's my job not to judge. You don't know what they were brought up with, and just to inform and give them options. What are you going to do? Okay, if you don't want to take medications, what can you do? And those women that don't want to take, well, I just talked about vaginal estrogen. One of the best things out there that you can use is probably in your cupboard right now. If you have dryness with sex, is coconut oil. Good old fashioned Walmart brand. Doesn't need to be extra virgin. You're not. Coconut oil. And we use that all the time in our business.
Yeah. Well, and you talked about how a lot of refugee cultures, like as you said, a lot of low income, a lot of refugee folks come through in these seminars, and then also your clinic. But it's also not like just low income or cultures. I mean, like
Mm.
the trad wife, white Christian woman denouncing birth control. Eve, I think it's Evie Christian Magazine is one of like the most popular American publications right now. It's a Christian woman's magazine, heavily sponsored, by the way, guys, by Palantir, Peter Thiel. You know how much I hate that man. Peter Thiel is the guy behind Palantir, named after Lord of the Rings, all-seeing ball of wisdom. Anyway, AI data guy out here sponsoring articles in EV Christian magazine to not use birth control, and so there's a lot of information out there that is peddled by men in Christian white spaces of telling women not to use Western science. And I think like the problem is as someone who's had my own journey with Western medication, is like there is like it's hard to find the right hormones for you, and it's messy and it sucks, and it's a whole struggle, and yet we have come so far in our understanding of the woman's body. Western medication has done so much for us, and then it's also just been such a challenge. So what a mess, what a nightmare. You talk about the cultures and the refugee stat on that side, but up here in Montana, we hear it up too. We don't see as many refugees, and it's very sparsely populated, but we have the same concerns of wanting a more natural approach or having concerns about quote what's in it. And it's just a tricky thing, and the best I want to do is just make sure that every woman knows as many options like for herself. Like if she wants to track it using the moon, okay, like I and or have, I know some people are using apps. I'm a little scared to use apps like with privacy and data and all that, but um that there's just so much about our own bodies that we're learning, and it's important that people like you who have that kind of knowledge in both the natural space and the quote pharmaceutical space, like that stuff is critical. I wish more people on both sides had holistic training like you had and exposure. I wish more, and I think that's really it's just good service, good health care to know like what can I do naturally and what can I do and what's my body just not doing that we need to get the lab involved. And so it's amazing.
Well,
You
what's really
talk.
crazy is a lot of times we have a lot. We spoke earlier about birth control. Birth control, a lot of people do, I'll do birth control. I'll do birth control pills because they'll say, because I heard hormone therapy causes breast cancer. Birth control pills are five times the concentration, a minimum of 5 times the concentration of what's in hormone therapy. And so I'll ask these women, I said, how long were you on birth control? Oh, I was on it 20 years. Uh-huh. Did you get breast cancer on that? Because that's twice the amount. Well, I heard that this is, yeah, it is different. It is a fifth of the dose that is in birth control. And they're like, well, I didn't know that. And not only are we having to tell patients what this is, but also we're having to tell our own providers what it is, because they don't realize, oh, wait a minute, those are kind of the same thing. They're just big sister and little sister, if you will, and how to use it. So not only is the woman confused, our providers have been confused because we have not really been taught anything on menopause the last 25 years since this study came out. I mean, hormone therapy, menopause education for providers literally just got squashed. And it's the demand of the woman nowadays that are lanking. I'm demanding to know what's going on. And many times they're going to their provider and they're like, I don't know because I wasn't educated in it.
Well, we are coming up to towards the end now. Can you tell me or the audience listening, what do you wish every woman aged 35 and over knew?
Well, if it's going to be on menopause, well, you can still have babies. You can, if you are having periods, you can still get pregnant. Um, you get closer to 40, they're going to be harder and harder, but there still is a chance. Some women think, in my mind, I think I'm too old to get pregnant, so therefore am not going to get pregnant because mind over matter. That does not work. If you're still having periods, technically you can still get pregnant. Hormone therapy, when you start seeing heavy periods, when you start seeing a change in your periods, whether it's coming longer or they're all of a sudden it went from 28 days to now 21 days, and then it goes to twice a week or twice a month, and then you're having those irregular, you have started the perimenopause natural transition. It is natural. Unfortunately, it is not pain-free. It is very confusing because it affects the brain, it affects your bones, your joints, your blood vessel, your skin, your hair gets thin. There's a big transition. And I want women, instead of going out there and thinking they're crazy or are reaching for everything. Because I've had some women that come in with literally a bag of stuff off Amazon. Quit buying all that stuff off Amazon, please. Come in and talk to us, because you have spent more on that stuff than you will if you come to and talk to a provider and get the real truth and find out what's going on. Many times we have found that just giving back just plain old good old estradiol, and we give bioidentical, the stuff your ovaries make, that actually is better than doing a bunch of antidepressants, anti-anxieties, which those can make you gain weight, kill your sex drive, which then again makes you gain weight and then even kills it more so. And so we get in there and hopefully realize that life isn't over when you become menopausal. Unfortunately, the second highest STD rate is in some of those senior women, because now they're like, I can't get pregnant. And they're like, woohoo!
No.
So, yeah. So,
That's
yeah, you
funny.
can still get STDs too. So,
Yeah.
you may
Wow.
not get pregnant, but you can still do that. And life is really good. We have a lot of knowledge, and there's a lot of us out there that do this for a living and take care of those women in that transition. You're going to be in this transition a lot longer than you are having babies. And so embrace it. Um, it's part of it. Every woman goes through it. Every woman goes through it, but just at a different degree. And so at 35 years old, this is what's coming somewhere in the next 5 years. It's coming to you. Is the hot flashes, the brain fog, the body aches, lack of sex drive, inability to fall asleep or stay asleep. Those are all symptoms that to us is natural. We're like, yeah, yeah. I mean, I've had some women in my visits that are 30 minutes long and they cry 3 times. They're like, what? Where is this coming from? And I'm like, and I explained to them, it's your it's everything going up and down as you're trying to transition over. It's natural. We don't have to put up with it. But what you're doing is we see all the time. You're not crazy. You're not crazy.
Thank you so much. How can people learn more about you or follow or yeah, point how can folks know more about you, Dr. Shelagh Larson?
Well, I actually do a lot of conferences. In fact, I'm in the middle, I'm at lunch break right now. I'm in a conference that I'm getting ready to speak on here in just a few minutes, talking about menopause in these different clinics and our struggles, not only with the culture, but also with our own providers that don't believe in menopause. You can also, if you're out there and you're like, I'm going through menopause, how do I find a provider that is actually trained in this? Because that's the other thing, is you can actually go into the Menopause Society. Don't work for them. I am board certified for them. The Menopause Society, and look up, they have certified providers on there that you can find in your state or in your area. Just put in your zip code and you can actually find one that is actually certified in menopause. That's what one of the things that you can do, and mostly is look at some more. I wouldn't believe everything that you're going to read on TikTok. Thanks for coming to this one, but go in and look at some medical societies, and look up some actual guidelines. There are plenty of guidelines out there on true what is going on in menopause, and be educated. Be educated. I actually, like I said, I've got a couple of chapters of books. I've got one textbook. I've got 3 chapters in this one. I've got another one that's getting ready to come out. So you can read books about it. Power is knowledge. Just like I tell those refugees, power is knowledge. And the more you know, and make sure it's from a reputable source, the better you're going to be.
Do you have a social media or a website that folks can follow you on or read more about you if they would like to follow up?
I think you did it. It was like um, Dr. Sheila, Dr. Shishi.
Oh, yes. Um, I didn't remember your Instagram handle. It's Dr. Sheila Larson NP or something.
Oh,
Is
yes.
that okay?
Yes.
Okay. Um, well, cool. That is a really lovely conversation today. Thank you, Mom, for coming on and sharing how misinformed so many of us are on our own bodies. I hope you'll come back. We'll do more questions. Um, uh, Simply an hour is not enough time, but I really appreciate you and you hanging out with me in the middle of your conference. And um, thank you. Thanks for coming on, Mom.
Love you, baby.
Alrighty, folks. So that
Bye,
was another
guys.
episode. That was another episode of Follow the Leader. I'm your host, Lee Larson. Let me know what you thought of that. Let me know in the comments and make sure you like, follow, subscribe. You know the drill. And until next time, I'll see ya. Bye bye.